a disease which the treatment of which is based on fluorescent angiogram. So it is characterized by accumulation of clear fluid at the posterior pole, causing a well circumscribed area of retinal detachment. Leakage of fluid occurs through a discrete defect in the retinal pigment epithelium, and fluid accumulates in the subretinal space. So in a case of central serous chorioretinopathy, various patterns which you may be seeing on fluorescent angiography are ink blot pattern or smokestack pattern, which are most common. Then there can be inverse smokestack, multiple leaks or diffuse leaks. Sometimes we do get just RPE defects or RPE detachment and there are no leaks, and in resolved cases there may be RPE tracts. So ink blot type of a leak starts as a point leak and spreads symmetrically in all directions in the subretinal space. Smokestack pattern is formed when a point leak, instead of spreading in all directions, reaches the highest point of neurosensory retina and then spreads laterally in an umbrella or a mushroom shape. Inverse smokestack can also be similarly there as a point leak ascending instead of ascending, it tracks down towards the lower limit. Then there can be multiple leaks, and they may behave either as an ink blot or a smokestack or a combination. That can be a scenario where there is no definite leak pattern. Instead, there is a diffuse area of leakage, or there is no leak and there are some RP defects, probably indicating a resolving or a resolved CSR. However, the fluid is not yet absorbed. There can be a pigment epithelial detachment, which is located within the neurosensory retina or outside, and the entire area of PED shows hyperfluorescence in the early film. This increases in intensity towards the late films, but the extent remains the same. There can be RPE transmission defects in resolved CSCR, and they are usually extensive, and the extent depending upon the previous extent of the neurosensory detachment. Sometimes the transmission defects are seen in the form of tracts extending downwards from the posterior pole and expanding inferiorly. So we will just go on to have a discussion about few of these patients which we come across. This is a patient showing characteristic ink blot. So in late frames, the leakage increases. The left eye of this patient showed a few RPE defects. Another patient who had multiple leaks and there were few RPE defects. This was a 51-year-old male with recurrent CSR in the right eye, and he had a macular scar due to a chronic CSR in the other eye. This is a typical smokestack pattern. It increases in the late frames of the fluorescent angiogram. Ink blot pattern very close to the fovea. The leak typically increases in the late frames of the angiogram. Multiple leak CSR with RPE defects. Multiple RPE defects, which is basically seen either in recurrent CSR or in resolving CSR cases. So left eye of the same patient showing multiple RPE defects due to chronic CSR. This patient underwent focal laser for both eyes. Another patient with multiple RPE defects. There was a history of recurrent CSR in the left eye. So RPE defects in the other eye as well. Another patient with single leak CSR and multiple RPE defects. This leak increases in the late frames. I think this is one of the CSCR is one of the indications where FFA is very, very important. So left eye of the same patient with double leak CSR and RPE defects. This is another patient of mine who had a recurrent CSR in both eyes. And in fact, he was treated with low fluence PDT and he maintains a vision of about 624. This is a lady who's been coming to us for more than 6 years actually. She has recurrent CSRs in both eyes. There was a single leak CSR in 2008 in the right eye. Then she had the same eye involved again in 2009. Then in 2010, she had a CSR in the left eye. Then now again she is presented in the right eye with a CSR, and the FFA shows a leakage here. In fact, we advise her to undergo tests to rule out tuberculosis, which have come out to be normal, and laser photocoagulation has been done to the single leak of CSR this time. Thanks a lot. So.